Good evening. My paper is on myopia control with highly spherical lensless target, HALT, and cylindrical annular refractive elements, care lenses, a comparative study. We know that myopia is an emerging epidemic. It is estimated that by 2050, 50% of the world population will be myopic, in that one-fifth will be high myopic. The myopia progression leads to increased risk of complications, and also the cost of correcting myopia and treating its complications causes heavy economic burden to the society and the individual. We usually give normal single vision spectacles and contact lenses, but they have no role in control of myopia progression. There are various treatment options for myopia control. In that, I am focusing on peripheral defocus lenses. Here in this picture, we can see how a single vision correction glasses correct the myopia. It actually corrects the myopia at the center. At the same time, it causes a peripheral hyperopic defocus. Study says that this hyperopic defocus actually acts as a stimulus for the axial elongation and myopia progression. While myopic defocus lenses correct the myopia at the center with a peripheral myopic defocus. This myopic defocus controls the myopia progression. Here in this, we have two entities, HALT and CARE. HALT contains a central zone for the myopia correction surrounded by 11 concentric rings for this myopic defocus. In CARE also, there is a central zone for the myopia correction surrounded by cylindrical annular refractive elements for the myopic defocus. Aim of our study is to compare the efficacy of HALT and CARE lenses in myopia control. This is a prospective non-randomized interventional study done between 2023 to 2025. All myopia patients less than or equal to 8 diopter of spherical equivalence of myopia with established progression of myopia more than or equal to 0.25 diopter per 6 months were included. Age was between 5 to 18 years. These were the exclusion criteria. Detailed history will be taken. Relevant examination and investigations were done. All patients will be counseled about two types of spectacle lenses. The type of spectacle lenses chosen will be by the patients. Follow-up was done every 6 months for 1 year. Primary parameters analyzed were change in spherical equivalence and change in axial length. Secondary parameters were NPA, NPC, contrast and pupillary diameter. Significant progression was taken as changing spherical equivalence more than 0.125 diopter per 6 months and change in axial length more than 0.05 millimeter per 6 months. Coming to the results, total number of patients were 34, in that 23 were in HALT and 11 were in CARE. At the beginning of our study, mild progressors were 5, moderate were 7 and rapid were 22. This classification is based on ATOM study. Mean age was comparable, that is 12 in each group. Maximum number of patients were between 9 to 12 years of age. In HALT, females were more and in CARE, males were more. The baseline spherical equivalence was also comparable, that is -4 in each group, and the baseline axial length was about 25 in each group. At 6 months, 43.5% in the HALT and 45.5% in the CARE doesn't show any significant change in the spherical equivalence. 39.1% in the HALT and 31.85% in the CARE doesn't show any significant change in the axial length. At the end of 1 year, there was a significant difference, that is 93.8% in the HALT and 75% in the CARE doesn't show any significant change in the spherical equivalence. 37.5% in the HALT and 25% in the CARE doesn't show any significant change in the axial length. This two graph shows mean spherical equivalence and mean axial length at each interval. Here we can see both HALT and CARE was efficacious at the end of 1 year in case of spherical equivalent progression, while this trend was not followed by the axial length. We also did a subgroup analysis in that both HALT and CARE were more efficacious in moderate progressors group at the end of 6 months, also in 1 year. Coming to the secondary parameters, at the end of 1 year, HALT lenses showed a reduction in NPA. NPC was comparable. CARE lenses showed a reduction in pupillary diameter at the end of 1 year. However, these values were not statistically significant. Coming to the discussion, more number of patients were between 9 to 12 years of age. This age is likely to have a growth spurt in children. In our study, more were in rapid progressors. At the end of 6 months, HALT and CARE lenses were comparable in their efficacy. However, at 1 year, HALT lenses had a significant effect on reducing spherical equivalent progression and slightly better effect on reducing axial elongation compared to CARE. Both HALT and CARE were more effective in moderate progression group. At the end of 1 year, HALT lenses showed a reduction in NPA. Both lenses doesn't have any effect on NPC and contrast. Only one patient in HALT complained about peripheral blurring with the glasses initial day, but was comfortable during the follow-up visits. CARE lenses showed a reduction in pupillary diameter at 1 year. However, it may not be significant because of the variation in the ambient light. To conclude, both HALT and CARE lenses are effective in control of myopia progression. HALT was superior to CARE at the end of 1 year. Both spectacles are well tolerated without any side effects. Less number of patients, less follow-up, and no randomizations or limitations. But why this study is important? To the best of our knowledge, our study, probably the first study from South India, which compares the peripheral defocus spectacles in myopia progression. And another study from North India by Rohit Saxena et al. On comparative evaluation of different spectacle designs in preventing myopia progression also concluded the same findings. These are my references. Thank you.
Thank you. Is this your thesis? All the presentation, no, you were mentioning these cases will be enrolled. You have already completed this study, right?
What's it?
You have already completed this study.
No, this is ongoing study, sir.
You are presenting the intermediate result, interim results.
We are following up these patients more.
Whatever data you show, that part is done, right?
Done, sir.
So what I'm saying, when you're presenting, don't say ki all patient with this will be enrolled. You have already enrolled, right?
Yes.
Cases with this were enrolled. So just change your language little bit, and when you're presenting as a bar diagram, rather than showing both for one category and then both for other category, rather than that you can compare myopia progression, halt, care, axial length progression, halt, care. That's how you should present the data. That will be more effective, and we can also compare both the groups. Okay, thank you.
Then we will exclude, they will be removed from the study.